All right, how we doing? So, for our last week, we are going to talk about working with children with special concerns. Talking about maltreatment, substance abuse, grief, family changes, violence. Uh, last week we talked about children with special needs. And I think these kind of go hand in hand, whereas there's something going on in life that's not really in the child's control that's really having that impact on them. Um, just so we're aware, I have my notes, my lesson plan, and my screen in front of me. I have the projection of the Canva up there. So if you see me looking up, that's where I am going with things. All right. So I like this quote from Mother Teresa. I have found the paradox that if I love until it hurts, then there is no hurt, but only more love. Let that sit in for a second. Kind of going back to what she said. Um, you know, it's uh, it's introducing that idea of hearing these heartbreaking stories and the importance of empathy paired with those professional boundaries and just knowing where your place is, knowing what these children need, but also knowing where kind of the line in the sand is. So we got child maltreatment. Let me get my okay. So this is a foundational topic for all counselors, whether you're working in school, CMH, anything like that. We're going to talk about kind of what it is, what our role is with it, um, mandated reporting, legal and ethical requirements, things like that. So, what is it? So, if we look at this definition, any recent act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse, or exploitation, or an act or failure to act which presents an imminent risk of serious harm. Right? This covers both commission, which is a fancy way of doing something, and omission, which is a fancy way of saying you didn't do something. So it's kind of both ends of the spectrum, right? Did I do something, or did someone do something to cause this maltreatment or this harm to the child I'm working with? Or was it that something was lacking, right? And if we remember that hierarchy we talked about earlier in the semester, um, we could definitely see a lot of the omissions, right? Like when we were looking at what are kind of the base levels, it was security, housing, food, access to education, things like that. Um, the key phrases in here are act or failure to act, right? And then imminent risk of serious harm. So the negligent, that's 78% is the most prevalent, is often overlooked. Um, Now, is that to say? I'm not saying that's just or anything, but like if compared to the other four or the other three, you could understand why it's maybe the most prevalent, but also understand why it's the least reported, or not least reported, the one that's often overlooked. Because if you have these others, physical abuse, you know, kids coming into sessions, you know, black eye, bruises, things like that, you're obviously gonna do something about it. Sexual abuse, client or student reports to you someone's For my girls, I took this from my buddy. We call it the bathing suit parts. Someone's touching their bathing suit parts, things like that. And then emotional abuse, like that's probably what we're going to hear a lot of in counseling, of just what parents are saying to their kids, how they're making them feel. But the neglect, sometimes it goes overlooked. And I say we, I don't mean we as in counselors. I mean we as in a society, because if we're, like I said, we're looking at the three of the other ones, those are pretty in your face. So let's define it, right? Physical abuse, non-accidental injury, punching, beating, shaking, burning, often a form of severe punishment or of severe physical punishment. This one is like when you get into slapping a kid. Personally, no, don't put your hands on a kid. But again, we talked about DCFS and how sometimes they're backed up. Sometimes the definition of physical abuse is different amongst different people, but always err on the side of caution. Sexual abuse. Using a child for sexual gratification. This is a profound breach of trust involving deception and exploitation. I think the biggest one we hear about, or maybe I should say I hear about, because I'm in the schools, is grooming. Teachers grooming students for years, and having inappropriate relationships. Then emotional abuse. Actions that damage a child's cognitive or emotional state. And something to really point out with emotional is if a child is witnessing physical abuse or witnessing violence at home, that is a form of emotional abuse. Just because they are not the ones being hit, touched, does not mean it's not abuse. So then we got neglect, right? And neglect, like I said, that was the big one. And that one, we can define it in 3 different areas. Physical neglect, failure to provide basic needs like food, clothing, shelter, supervision, or medical attention. Educational neglect, allowing chronic truancy, not enrolling school-age children, or ignoring special education needs. I think recently, I have seen a real uptick in the chronic truancy. I think there's sort of been a shift since COVID and everything being on Zoom, of attending school is required to attending school is if it works in my day, right? I can only speak to my school district that once a student is called out for so many days, then attendance aren't excused anymore. They're reported as cuts. They still put in the notes like, parent or guardian reached whatever days. But yeah, that's definitely something we've been seeing. Special education needs, like, I think sometimes when we think of child maltreatment, again, maybe this is me projecting, we think of parents or guardians, but this could be a school, right? If a student has, or I guess for my CMH friends, a client is a student and their special education needs are not being addressed, schools refusing, teachers are refusing, that's a form of neglect. And then emotional neglect, that should be an F. Typo. Failure to provide, I almost tried to play it off like it was a word. failure, like that was a real thing. Failure to provide affection and emotional support. Spousal abuse in child's presence, permitting drug use. Yeah. I think we talked about it a couple classes ago when we've had we could think of those friends whose parents were the cool parents and let kids do things at their house that they maybe weren't supposed to do. Yeah. More common than you think. Experts estimate that the actual number of incidents is more than 3 times greater than what is reported. Which is crazy because if you look down here, 3 million reported annually. So if we're looking at 3 million, they think it's more than that. They think it's 3 times more than that. Ooh, even 3 million a year. That's pretty high. 4 to 7 children die every day as a result of child abuse and neglect. 81.5 of victims are maltreated by one or more parents. Then again, the 3 million reported. So, thinking of 3 million, right? Thinking of the 3 million reported, thinking of actuality, probably closer to 9 million. There's probably a good chance you're going to be working with a client or talking to a student who is suffering some form of abuse or neglect. So then legally, what do we got to do? So the big concept, you're a mandated reporter, right? It's not optional. Like, you just are. When you're working with children in certain roles, you are a mandated reporter. All states require professionals who work with children known suspected abuse. The standard isn't proof, it's reasonable suspicion. Again, that's where, your job is not to investigate it necessarily. Your job is to report the suspicion. That's why I talked about, with the slapping and physical abuse, err on the side of caution. You'd much rather be wrong in reporting it than wrong in not reporting it. Not even just from a legal sense, but just from a ethical and just how you feel. State laws define the specifics: who, what, and when. In Illinois, it's pretty cut and dry. It's the big 3. Hurt yourself, someone else, someone trying to hurt you. Which I think, if I go back to our 4 main types, these all fall into hurt yourself, hurt someone else, or someone's trying to hurt you. So whenever there's a concern for safety, I think that's the easiest way to do it. Whenever there's any concern for safety, physical safety, sexual safety, social emotional safety, basic needs safety, that's when you report it. And even, I would recommend, if you're someone that gets nervous, running it up the flagpole right away and going immediately to, a boss, or in school as an administrator, or immediately contacting DCFS. Consult with a colleague, right? Don't hold this in. Don't wrestle with it, right? Once you talk to someone else about it, right, now you got someone else that knows, and now they can help guide you. But always err on the side of caution. So here is a scenario. So I'm going to read it. I'm going to ask you to pause the video for about 5 minutes while you think about it, and then I'll give you the answer. A 10-year-old boy says, "My dad got really mad last night and threw a plate. It hit the wall and a piece hit my arm." The child shows you the small cut. Does this meet the standard for a report in your opinion? Why or why not? What type might this fall under? What are your personal feelings about making this call? What are the consequences of not reporting versus reporting? So I want you to pause for 5 minutes. Now pause. And we're back. So question 1, does this meet the standard for a report in your opinion? Yes. Why? Because this kid has an injury from a parent's actions. So that is that is maltreatment. That is a mandated reporter, right? Someone maybe it's not as black and white as someone trying to hurt you. I don't think his dad necessarily was trying to hurt him, but his dad did something and it hurt him. It would be physical abuse. It could be emotional abuse or neglect, right? They witnessed if this was domestic violence, if he was arguing with his wife or the kid's mom or anyone that was in the house, imminent risk. It was volatile behavior, and it failed to protect the child from harm. Obviously, we're not going to share these, but I think, well, maybe I won't ask. I'm not gonna. Your own feelings about it, but consequences of not reporting. Like if we're talking just legally, like yeah, you could be on the hook. You knew about this, kid reported it to you, you didn't say anything. Right? This child safety always supersedes the therapeutic rapport, the therapeutic relationship. So, yeah. And I will tell you, like when it's black and white, it's easy to do. But again, we live in the world of gray. And I will tell you, sometimes it does feel a little weird. It does feel a little uncomfortable. You do kind of get a little tight when you might have to do this. But again, just imagine what might happen if you don't. Right? I think about, I had a student when I was coaching basketball. This was over. It was funny because I was the head basketball coach. The freshman team still decided to have practice, and it was New Year's Eve. And I was like going to relax during the day, go out and celebrate that night. My freshman coach calls me, hey, so-and-so showed up with scratches and said da-da-da. And I was like, oh, it was my day off. But I go and I talk to her, and yeah, she was self-harm, suicidal ideations. So I had her dad come in, talk to him, told him what's going on. And he's like, yeah, I appreciate you reaching out, but she might be just going through a phase. She's probably just joking, or she's probably not serious about it. And I said, you know what, and I had to appease him a little bit. I said, you know what, that could be what's going on. That could be a valid explanation. But then I looked at him and I said, but what if you're wrong? And you could see like it almost looked like his soul collapsed. And sure enough, that was actually my last year coaching. That was my last year at Elmwood Park. And, the awards night at the end of this season was very emotional anyways. But the mom came up to me and she literally said, like, Coach Linhart, like, you saved our daughter's life. If it wasn't for you, we wouldn't have got her support. She wouldn't be in counseling right now. She wouldn't be doing so well. So it's hard, but it's our job. So we got some risk factors, right? What are maltreatment is like the perfect storm of risk factors. It's rarely a single cause. So what are some things that, according to our text, that studies have shown are usually kind of going on with the maltreatment, right? Substance abuse. 33 to 66% of the cases deal with this, right? And it could be that intergenerational cycle of parents who had, substance abuse. Their parents had it, and so they took it out on the kids. History of abuse, not necessarily just child abuse, but have there been concerns in other areas of life related to abuse? Low self-esteem, poor impulse control, social isolation is a big risk factor. Depression or anxiety, kind of, it's tough to say someone is diagnosed with that's a risk factor, but it could be. And then unrealistic expectations of the child. This could be academic, this could be athletic, this could be social, this could be, whatever. Oh, and here was it. Sorry, spousal abuse was here. So 30 to 60, again, that overlap. Very similar to what was the one for substance abuse? Kind of, not the exact same percentages, but pretty close. High stress, financial stress, marital conflict, social isolation. If you have a parent or guardian or someone, anyone that's maltreatment of a kid, that they don't have that network of support. They don't have, just right there. Yeah, they have very few supports. They don't have anyone to process with. Community acceptance of corporal punishment. Yeah, I mean, this could be, immediately my head kind of goes to like, no, I won't say it. But yeah, if they are in an environment or a family where corporal punishment is just kind of like, no, it's not a big deal. This is how we correct behaviors. This is how we right our wrongs. You're probably likely to see that with these kids. So protective factors. So instead of just focusing on why things might be bad, let's look at how things can be good. What protects, right? What protects these kids? These are the anecdotes to risk. These are the things we try to build through counseling. Nurturing parent-child bond, right? A trusting attachment. Remember, we watched that video earlier in the term about the different forms of attachment, and there was the unhealthy attachments and the healthy attachments, and how each child kind of turned out. Parent resilience, just teaching the parents coping skills. Parental resilience, the ability to cope with stress, be flexible, and bounce back. Social connection, right? This is kind of, a lot of these are like the yin and yang of the risk factors, right? We had the social isolation, not having that support system, to now a protective factor is social connections, a support network of friends, families, and neighbors, right? Kind of with parenting, it's very similar to us. You could almost explain it where, if we don't know what our next steps are, drink word, cheers, collaborate, right? It'd be the same with parents or guardians or anyone working with kids. If you don't know what the appropriate kind of next step is, what the appropriate consequence maybe is, talk to someone. Talk to someone in your social group. Talk to, think about, those of us that are old enough, or I guess we're all old enough, but those of us that have children, how many times has something happened and, you had to redirect your child? Have you consulted with your spouse? Have you consulted with your own parents? Have you consulted with people on the block? Have you consulted with people at work? And then concrete support, access to basic needs like food, housing, and childcare. It's kind of interesting when you think about that, because we talked about that pyramid of the basic needs, but it's not necessarily just for children. It's for adults too, right? We need access to those things in order for us to, I'm not making it black and white again, right? We live in the world of gray. But when I'm looking at these last three, kind of makes me think of the stories you hear of, I'll keep it a little bit lighter, where, someone has a bad day at work and they come home and take it out on the dog. Maybe think about times your parents or guardians had a rough day doing X, Y, and Z. And I'm not going to say they abused you. Hopefully they didn't, but like they maybe weren't the greatest to you. And so I think this is it too, right? It's we don't live in silos. Our lives aren't in silos. Like, this is now, okay, now it's parenting time. Okay, now it's teaching time. Okay, now it's work time. Okay, now it's social time, right? These things kind of have ebbs and flows. So definitely, if someone working with a kid, or someone, a parent or guardian, has some things going on outside of the house, the workplace, it could bleed in, right? All right. So this is table 19-1 from our text. I'm not going to read it verbatim because you all know how to read. But I want to highlight some of these patterns that you might see in here. Many signs are behavioral or emotional, not just physical, right? And those are the ones that come out with us. Some things you might see if there is physical abuse: frightened of parents or guardians. Again, I'm hypersensitive to just saying parents because I run a grief group for kids who've lost a parent. Maybe trying to extend leaving, either leaving school if you're a school counselor, or leaving a session if you're a CMH. Neglect. If you have a kid that's begging or taking food, maybe their hygiene isn't kept up. This one might be more for school counselors, because there's I think it's safe to say there's a better chance you would see them there. You could physically see them, maybe not necessarily meet with them, but physically see them more than a CMH. Like, are they wearing the same clothes over and over and over and over? Things like that. Sexual abuse. CMH friends, if they have a concerning knowledge of things related to sexual relationships for their age. Those of us in school maybe refusing to change before PE. Body language, covering up, things like that. Emotional abuse, extremes in behaviors, right? The highs are high and the lows are lows. And then the overall kind of red flag with signs and symptoms is these sudden changes in behaviors or patterns in their day-to-day life that just don't really add up. The patterns of that you can't really explain, these don't really, I can't really put my finger on it. It just isn't related to anything else. Doesn't make sense. So the long-term consequences, this is why we intervene. because the impact of this maltreatment, abuse, can impact the rest of their lives. So we got physical and cognitive, impaired brain development, higher rates of allergies, arthritis, asthma, and high blood pressure in adulthood, lower language development and academic achievement. This is when the trauma, for lack of a better term, kind of gets under the skin, right? And it's kind of working its way underneath there, and it's coming out in different ways. Then the psychological behavior, you just have a higher risk for depression, anxiety, PTSD, eating disorder, substance abuse, isolation, trust. In my district, we do this thing called Trusted Adult, where students identify a trusted adult. And I'll be honest, you get kind of proud when you get your list of like, hey, I'm making an impact. But I've been asking for a while if one of the options, because it's either you pick someone or you leave it blank. And then basically through our administration, they tell us we have to, reach out to these kids as school counselors and say, hey, you haven't picked a trusted adult. Could you go fill that out? But like, one thing I've said to my boss is, I asked him, I go, is there an option for no one? Is there an option for a kid to mark no one? I don't have a trusted adult. And he said no. And I'm like, I kind of want that, because I think that's just as important, maybe even more important than identifying. Like knowing, like, hey, if something's going on in this kid's lives, all right, let's look up their trusted adult, see if they could connect with them. But if a kid is, I don't like the false negative where it's like kids that just don't answer it and kids that maybe don't have a trusted adult are kind of one and the same. Because yeah, obviously it's definitely, could be a factor, right? Let's get them hanging out with a counselor or a psych or a social worker and kind of see what's going on here. Assessment and interviewing. Motivational interview? No. That was so dumb. I'm sorry. So your goal is to assess overall functioning and safety, but like you're not conducting a forensic investigation, right? You want to make sure the overall functioning and safety, make sure the child is okay. Open-ended prompts. Okay, maybe this has got a little MI in it, right? Open-ended prompts I'm a big fan of because they can't just yes, no you. They can't just I don't know you, right? They got to give you some meat with the potatoes. They got to give you a little bit of something. Body language, right? Like 90% of what we say is nonverbal or something like that. You could tell for our little image here. I made an extra one. I used AI to make it with that little logo in the bottom right hand corner. Be empathic but neutral. That's tough, right? That's really hard in counseling to like kind of check yourself and make sure what you're saying is middle of the road. It's not pushing them, trying to get them to say something, trying to get them to feel something. It's essentially for this, right? Like if we're going back to the questions, that's why open-ended questions are like, tell me about a time when ... as opposed to closed or leading questions. Did he hit you? Right? So you want to use the child's own terms, right? Like private parts or like I said, bathing suit parts. Again, just meeting your people you're working with where they're at. And so then one of the interventions is child-parent psychotherapy. This is a gold standard for kids 0 to 5 that are traumatized. the kind of the big belief with this is that the trauma happened in the relationship, so the healing has to happen in the relationship. Um, and instead of just working with the child or the parent, the care, you know, the provider, it's working with the dyad of both, working with both of them together. So to get a better understanding of this, we're going to watch a video. Here we go. Does it let me play him here? Can I not play him here? Play. No. That stinks. Anyways, please go to YouTube and search for Child Parent Psychotherapy Clinical Formulations Triangle. Man, unless it's playing right now and I'm talking over it. If I am, I'm sorry, but no, it doesn't let me. Let me see if I go back. Nope. Okay. So go to YouTube. Okay, so this is going to really cut into this video, but we'll assume we're just adding time for you watching the video and then answering this. How does the triangle help? That really disappoints me. Oh well. How does the triangle help a counselor's understanding of the parent's experience, not just the child? What does this mean in the context of maltreatment? I left the answers for the other two. Sorry about that. But you can kind of see. So I think this will help you understand it better. I got to tweak this presentation. We got a typo. We got answers. The answer to the first one, since we got the other one, would be it's a map. The child's behavior triggers the parent's feeling, and because of its meaning, I'm a bad parent, or this is what it sounded like before I was hurt. So yeah, watch that video. It's pretty interesting. It's disappointing it's not playing here, but obviously we will assume you watched it. So I will, this video will be a little bit shorter. But now we got substance abuse in families. Let's look at the relationship between maltreatment and substance abuse. So kids in chemically dependent families learn unhealthy survival skills. So we got don't talk, don't have problems, pretend problems don't exist, don't air the family's dirty laundry, right? Family's got a secret. This can definitely create some isolation. Don't trust. Trust is dangerous, right? If the person you're supposed to trust the most or are the closest with or interact with the most is unpredictable and unreliable, if I can't trust them, I ain't going to trust anybody. Then don't feel. These feelings can be dangerous or it can set off the parent or guardian who's struggling with substance. Might bring more pain and might worsen the situation. Common roles children assume, right? These are some survival roles that kids adapt to just to get by. The family hero, overly responsive and mature, the perfect child who tries to make the family look good, right? So they kind of take on that role of trying to show, hey, you know what, everything's okay at my family. You don't, nothing wrong's going on. And really not allowing the child the place to kind of feel or process. The scapegoat. Everything that happens wrong in this family is because of me, right? Mommy or daddy are drinking because of me. The lost child. It's going to isolate if, Kind of like a T-Rex. If I don't move, they don't see me. If they don't see me, they can't yell at me. Problem's not there. And then the mascot, right? This is where we're trying to use humor to deflect tension and manage anxiety, right? If I can make people laugh or make things silly, things will be okay. So what are some key messages, right? We want to, as counselors, we want to challenge these unspoken rules and try to get them to adopt new healthy messages, right? You are not alone. This gets rid of that don't talk, don't say anything. It's not your fault. This goes over the 3 C's. You didn't cause it, you can't control it, you can't cure it. I've seen that a lot with high school kids. Whether it's something at home or something in their own lives or something with a friend, like there's definitely times when I have to say to them, like, hey, how much training do you have in counseling, psychology, social work? They're like, well, none. I go, exactly. So you can't expect yourself to know how to address these on your own. You can't control it. So let's talk through it. Your concern is valid. There is a problem, and it's okay to be worried about it. You're not crazy. This is a problem. You can love the person without liking their behavior. This is a big one because it separates the person from the disease. And then empowerment. We can't control their behavior, but we can focus on our own choices. Death, depression, suicide. These are some of the most acute issues that we will face. So, first off, how do kids understand death? Whenever you're working, again, I've said this ad nauseum, meet them where they're at. You need to use you must use a developmental lens. Younger children may see death as temporary or reversible, right? They're just asleep or they're going on a trip. They'll be back. They may blame themselves. Because I was mad at them, that's why they passed. And then the primary need to know who's going to be there for them, who's going to take care of them. That makes me think of not 3 to 5-year-olds, but in the group I'm running, I had a girl who was telling me her stepdad passed and his family reassured them, like, hey, reassured her and her mother, we're always going to support you. We're always going to do this. You're a part of this family. And she said, and then like a week later, the rug got pulled out from under them and they don't talk to them anymore. And so that scared her. And that's understandable, right? So when you need, she needs to know, where's my support system at? And then as they get older, they start to get it, right? They know, like, hey, it's final. Like this, someone dies, they die. It's universal, and this can be frightening. I remember, it made me think of me, but then also made me think of Nate Bargatze's got this joke where he's talking about how their dog is getting old and sick, and it's gonna, they're gonna have to put it down soon. And he's like, and that dog lasted longer than I thought. And he's like, and he had to keep saying over and over that the dog's gonna die. And he was like, the dog's gonna die, I'm gonna die, your mother's gonna die, you're gonna die. But like, it's a little tongue in cheek. But I thought about it like when, when I first kind of grasped that concept as a kid of, oh wait, like everyone dies someday. Like it's tough to for a kid to wrap their head around, right? What do they say? There's only two things guaranteed in life: taxes and death. Yeah. So, group activity again, you're going to do it by yourself. And then I will pause and I'll give you the answer. So, what do you say? Is mommy sleeping? How do you directly address causality and the self blame that comes from magical thinking? Was it my fault? How do you gently explain finality using clear language, not euphemisms like passes away, which can be confusing? Who will pack my lunch? How do you provide them reassurance about the future and their day to day care, which is their most immediate concern? So take 5 minutes and pause. And we're back. So for the first one, you want to be gentle, clear, and honest. Think about some things you could say that are not using, like the second one said, those, and not using euphemisms in there either. With the second one, direct, immediate, and absolute. No, this wasn't your fault. Nothing you said, thought, or did that caused this. And then who will pack my lunch? Reassuring, like, yeah, that's an important question. From a parent perspective, if it's the other parent, could be, from now on, I'm going to pack your lunch. Or if you're working with a child that asks this, you know what, we'll make sure to get this figured out. Because again, that's pretty down there on that pyramid. Wolfett's tasks of grieving. So this is a more active model than the stages of grief. Grief is work the child has to do. So this is just not what's going to happen to you, but this is things you have to do. The kid has to understand and accepting the reality of the loss. Like they're gone. They've passed. Facing the pain, not avoiding it. I think about, I used to watch this video on YouTube with my group. It was like 64 things they never told you about grief, and they've taken it down. I wish it was still up there. But like back to back, let's just say it was number 17 and number 18. They would say like, it's okay to cry, and then it's okay not to cry, where it's like you need to face your emotions right then and there and not avoid it. Building memories or commemorating the deceased. What's cool about that is I tell the students in my group, like, you now get to control the narrative. Like, my daughters never met my dad, but like, I take the responsibility very seriously that I get to paint the picture and let them know who Grandpa Leo was, and create memories that they say, hey, remember when you told me Grandpa Leo did this? So it's pretty cool. Adjusting to the new environment where the person is missing. In that, that could come into also like who's providing those supports, making lunch, whatever it is that person provided. Trying to find meaning, right? Making sense of the loss. And then moving on with life, understanding, we can mourn, we can celebrate, we can always remember, but we need to take that next step. So then, kind of going back to this, some interventions you could do related to this is create a memory box, right? They could decorate a shoebox and, items that remind them of the parent they lost. A memory book, a goodbye letter. There's this really good book. It's actually sold out right now, but it's by the Doogie Center. It's called I think it's called the Deconstruction Reconstruction Journal. I've been trying to buy some for my group, but luckily I got a sample copy, and I've been just photocopying, copying stuff and putting it in Google Drive and sharing with my students. I don't know if that's copyright, but like I'm trying to buy it. I'm trying. But it's got some really cool ideas. Like we did one where we created a Spotify playlist for songs of all the parents that people lost. I saw online once and this is in a group setting, right? So I'm talking about group counseling for grief. They did something called a trauma salad where they brought in sweets that their parent or guardian in the past liked. And they kind of mixed them all together and took home baggies of it, things like that. And that's a way to, build memories or commemorate the deceased, right? So then we got depression and suicide. So it's persistent sadness or hopelessness, right? It's not just a kid coming in saying, "Oh, I'm so depressed." This is in about 5% of children or adolescents. And it's not just sadness, right? It's not just sadness, but it's the anger, irritability also associated with it, right? And there's the loss of interest, changes in eating and sleeping. Then we got suicide, and this kind of makes people tight to talk about. And sometimes we think, I don't want to overgeneralize, sorry. But I know in other classes I've taught or other people new to the profession I've worked with, they've thought, I'm working with kids or teenagers. Like, we're not going to have to deal with suicide. And I wish you were right. I wish you were right. But the thing is, we are. It's the third leading cause of death from ages 10 to 24. Persistent suicidal ideation is the single best predictor. And I think, too, there's a misconception that talking about suicide puts it in a kid's head. It doesn't. It doesn't. So just, studies show it doesn't. Like you want to have an open dialogue about it. And then what are some things to ask when doing an assessment? You want to be direct. Again, you are not planting the idea. You're giving them permission to talk about it. Those are two vastly different things. Do things ever get so bad you think about hurting yourself? Did you ever feel so upset you wished you weren't alive? Are you thinking about killing yourself? Do you have a plan? Right? If a student I keep on saying student, I apologize. If a child or teenager has a plan, they are at really high risk. And these kind of go like in order. They escalate. And so one thing I have is if you go to this, I've talked a couple times about the Columbia that we use. So if you go to tinyurl.com/blank Columbia, it'll show you what it is. And it's really, when I've had to do it, kid comes in, you kind of let them know, like, hey, I'm just going to be firing questions. It's very canned, and it is just, I'm going to just ask you questions. Go, like answer. But I also feel like it's important to also know what this could look like. So then if you go to tinyurl.com/done Columbia, you could see I obviously redacted some information for confidentiality, but you could see what a completed one looks like. But what is your role in suicide intervention? Number one, never keep it a secret. Never promise you're going to keep it a secret. No. This is obviously one of those limits, non-negotiable limits of confidentiality. Never leave them alone, right? You don't want to walk out of the room. You consult, you tell the parents or guardians immediately, and you ensure a safety plan. So now we got changes in the family structure. I lost where I was at here on my notes. Uh, this could be very common and something you're going to talk, very common in a lot of your students or patients' lives, but could still be difficult and create its own sense of challenges. Families go through stages. The first two are often the fantasy stage, the dream that a new blended family will be ideal. In the immersion stage, reality sets in, things are different and awkward. And I want you to think about this question. As a counselor, how would you help a child move from the fantasy stage to the immersion/awareness stage without invalidating their hopes for a happy family? And like stages of grief, there's different tasks that kids will have to take in order to heal with this, in order to cope with this, in order to be okay with this. The first one is acknowledging the reality. Second one is disengaging, resigning from being a messenger, spy, therapist for the parent, get back to being a kid. And then lastly, resolve anger and self-blame. Right? It was not their fault. A lot of times kids might think this was my fault. Children and violence. So finally, we're going to talk about aggression, conduct problems, and bullying. So these are the dimensions of conduct problems. So we'll look at them. We'll look at like the overt and covert as like a pair. Overt, fighting, bullying, arguing, assault. Covert, lying, stealing, fire setting, vandalism. Destructive, non-destructive. Cruelty to animals, assault, vandalism, non-destructive, arguing, stubborn, substance abuse, trauma. Relationship aggression, right? These are like the mean girls. Verbal insults, gossip, exclusion. So you could kind of see, I pulled this from our text, the 4 different categories of conduct problems. Then we got bullying. What is bullying? Bullying is sometimes a term that's just thrown out a little too, I don't want to say wishy-washy, but like it's like a person is bullied when exposed repeatedly. That's the big one. Repeatedly to negative actions, has troubles defending himself or herself or their self. So there's 3 key elements to it. Aggressive behavior, it's repeated over time, and it's an imbalance of power. So what are the common types? I think we've all seen these. I think we could all understand these. And then how do we resolve these? Conflict resolution. Listen objectively to hear the other person. Identify the problem. Brainstorm alternatives. And find a win-win solution where both people get something out of it. So you want to attack the problem, not the person, right? It's not, if you're working with little kids, it's not you're a jerk. So we both want to go on the swing. And this is a lot of times where you see that peer mediation group, right? In schools where you see students kind of being trained and stepping in. And on that note, we are done now in different terms. I have taught this at different times or went over this at different times. So that's why it says next week there is a YouTube, but obviously there is not for us. Yeah, we did it. We did it. So I hope at this point you have a better grasp on working with children, working with adolescents, working with working with teenagers. I realize I need to update the things on in our module. I'm going to do that right now. But I had fun with both these classes this term, all of you. And I hope you did as well. And yeah, that's it. That's a course. Ooh, ooh. So please make sure to check your stuff. The quiz and the discussion board will be posted a little bit later today. I'm asking that by, let's say, next Wednesday by midnight, everything is submitted and done. I'm going to be going through and putting zeros in for everything you owe. So please make sure you take care of that. Otherwise, hopefully our paths cross in the future. If you ever need anything, please don't hesitate to reach out. See you later.